హలో ఎవ్రీవన్. మనిషికి అసలైన అందం చిరునవ్వు. మనం ఎంత స్వేచ్ఛగా నవ్వాలి అనుకుంటే మన పళ్ళు అంత ఆరోగ్యంగా ఉంటే మనకు అంత కాన్ఫిడెన్స్ వస్తుంది. సో ఈరోజు మనతో పాటు డెంటిస్ట్ స్పెషలిస్ట్ షాదాబ్ గారు మనతో ఉన్నారు. పళ్ళ చాలా ప్రాబ్లమ్స్ వస్తూ ఉంటాయి. ఈరోజు మనం స్పెసిఫిక్గా జా డిజార్డర్ గురించి మాట్లాడుకుందాం. హాయ్.
Hello, how are you? I'm fine. Thank you for having me on this show.
Thank you. It's our pleasure.
Today I will be talking about the jaw discrepancies which happen in individuals ranging from all the age groups from childhood to adults. So to start with, these jaw discrepancies can be easily identified at a very juvenile age when the child is growing. In anywhere around 10 to 12 years of age, it will be quite evident that the patient is on his or her way to have any jaw discrepancy. So it is the prime duty of a general dentist, if the patients approach him, to direct those patients to an orthodontic specialist and an orthopedic surgeon, to dentofacial orthopedic surgeon, to identify that cause, eliminate the cause, restrict the unfavorable growth and redirect the growth of the jaws. So normally we find in our society that most of the children have their upper jaws totally proclined outside, or the lower jaws totally backwardly placed. So that is when you can identify that some kind of skeletal discrepancy, the bone relationship between the upper jaw and the lower jaw is getting deranged. So now what to do? If you identify such a child in a very early age, where the child is still growing, that is around 8 to 12 years of age, when the growth period is quite at its peak, and whatever modulation you want to bring in the jaws can be done. So that is the best time to give these patients orthopedic appliances. There are various kind of appliances, for example headgears, chin cups, and many other myofunctional appliances which can correct all these jaw discrepancies within time, preventing the patient to undergo extensive or intensive surgeries later on. Because once the child,
if we do surgery at that time,
there is no need of surgery at that time. We are just redirecting. Suppose the lower jaw is going back, we can bring it forward through those appliances. If the upper jaw is going front, we can restrict it and stop it where it is. If the lower jaw is going forward, some children have this kind of jaws, which are prognatic jaws. We can restrict the jaws and we can again adjust it back to its normal position. So growth can be modulated because that is, the nature has given us time. Time is a very important factor in orthodontics. So catching growth and making the best use of it will prevent that child to undergo any extensive or intensive surgeries later on, which after growth will be difficult. Once the growth period arrests, there are various sutures in our jaws which get fused because of bone deposition.
That will become some more complicated.
Yes, so that cannot be opened up in the future years of the life. So for that to happen, either the patient has to go with heavy skeletal anchorage systems, or they have to undergo proper surgeries so that discrepancies are corrected. So normally this is the notion that most of the normal patients, they say the child should not be shown to the doctor unless he is 13 years of age.
Exactly, I am about to ask that question. Some children they will be physically weak due to some health issues or something, and some parents, what you are saying, they are we should not take our kids to doctors. They'll have these type of myths. So is that child having some kind of physical weakness, he is capable for that treatment at that age?
First of all, if the child is showing any physical weakness, he should be consulted to a pediatrician first of all, before even we go ahead with the dental corrections, because mostly the child will be healthy. And according to the American Association of Orthodontics, the minimum age for a child to be screened for orthodontics, that is all the functional appliances, orthopedic appliances, is 7 years of age. So from 7 years of age, there should be proper screening of the child till he grows up to become proper in an adolescent stage, wherein still growth is left. Once he becomes an adult, then it's a little problematic issue where the patient will have to undergo a surgical procedure to get things corrected, because remodulation cannot happen once the patient grows. So this is a problem.
And when some people smile, we can see their gums totally.
Yeah.
That comes under this category?
There is something called as rotations of the jaws in orthodontics. wherein if there is any inverted rotation, like for example the clockwise rotation of the maxilla, which should not happen, but it happens in some children, that has to be redirected. It has to be counterclockwise movement. The appliances will make sure that the jaw doesn't further go down in a clockwise manner, thereby exposing the gums, rather than it will redirect it in an anti-clockwise manner and bring it to a normal position. So these all corrections can be made during the growth period. Once the patient has crossed that period, and if an adult comes with that gummy smile, heavy gummy smile, there are two procedures can be followed. One is the skeletal anchorage systems, which are recently introduced by Dr. Sugawara, and he's the pioneer in this skeletal anchorage systems. And what he has told that using mini screws or mini plates, this kind of jaw discrepancies wherein excessive gum exposure are there, where the appearance is not very good, even for example, especially for the girls, when they smile they don't get appealing looks.
Smile is like the first appealing thing.
Exactly. So using skeletal anchorage system, to some extent these corrections can be made. There is something called as envelope of discrepancy in our orthodontics, wherein a range of movements and a range of corrections can be made within those envelopes. So skeletal, to some extent, skeletal anchorage can correct that, but if the patient is expecting 100% results and very good outcome, then the patient will have to go for surgeries. And there are various surgeries which an orthodontist and a surgeon, oral surgeon, together as a team, we perform both orthodontic and surgical corrections, wherein again there is repositioning of the jaws. There are various surgeries like the Leafort surgeries, there is bilateral sagittal osteotomy surgeries, there are genioplasty surgeries. There are many surgeries which have to be performed for that patient to get back into the best possible looks. And there are softwares developed wherein we can show the patient the end result even before the patient has undergone surgery. That will motivate the patient for undergoing that surgery.
Exactly.
That's a very good software which we have. That is the Dolphin software which we have been using. So in that the end result is already shown to the patient that after surgery this is how you will be looking, and there are definite results. But then my appeal to the audience is, why to wait for so long? Get your children, get them screened at correct time, and get these appliances done so that corrections are made in time, rather than letting the children grow as they are growing and just waiting for things to happen, and then if they don't happen, you are only under the pressure that now he has to go or she has to go for extensive procedures.
Yeah, they have to realize early so that they can come immediately.
That's what.
So that
My aim for this interview is to motivate all the audiences and their families that get your children, get them checked once. Nothing will happen. Just a visit to a dentist can solve at least he can direct you. You take a decision or not, that is a secondary issue. At least we can direct you in the correct path so that you can then take your decision. At least you have some information about the growth of the child. That is very important.
exactly. Whatever you said is 100% true. If there is some occasion like marriage or something, then they'll come to you and they'll say like we want treatment and all. And I'm having one doubt, like you said about the final preview. Whenever we got this treatment or surgery, after that also we have to follow few steps or few rules. Few people, they'll do surgery or treatment and they won't follow anything, any precautions, and they simply blame doctors. That case happened to you?
See, it depends on the first day of the visit, where the doctor speaks to the patient. How well he motivates him, how well he is positively inclined towards the treatment, and how well he executes that. All will come in the first visit when if you are my patient and how I meet you. The moment I meet you, I should be able to motivate you for maintaining the expected results. So what happens is, whenever these all changes take place, it takes at least a year and a half or two for all these changes to settle down and become stable in that corrected position. Because once again bone deposition has to occur, once again the sutures have to ossify, and once again the entire occlusion has to settle down. So all these things matter. So if a patient is desiring the results to be permanent, as they say permanent, nothing is permanent, but still if they say permanent, and for a longer time of their life, they have to follow the protocols again given by the American Academy of Orthodontic Dentistry, where the amount of treatment, active treatment you have done, an orthodontic treatment, it is equal time of retention which is required. Like suppose if you have undergone 2 years of treatment, it is mandatory the patient undergoes 2 years of retention so that the results are permanent. There is no relapse, There's no again going forward of the teeth, there's no again rotations of the jaws or going back of the jaws. So all these things have to be maintained. Still, even if in a child we are doing, if the functional correction is corrected, if the jaws are corrected, again that retention has to be made till the growth arrests, till the sutures ossify. At least like 6 to 8 months to 1 year, that retention is made. There are phases in those therapies. There is an active phase, there is a supportive phase, there is a retentive phase. So all these phases have to be followed holistically. We cannot just tell. But for all this, doctor and patient both are like, there's a symbiotic relationship.
Exactly.
You have to motivate the patient and make the patient come back, have reviews. We are there to serve you. We are there to see that you are in the best form which you desire.
And moreover, the patient should be like motivated, and he should kept going on.
I love patients who come for reviews because we are ready to see what's going on. We are not scared that we have done something, let the patient go. That is not the way to work. So we want patients to come back, give their reviews, whatever is going on. Hopefully everything will be fine after that.
So exactly how many categories, like jaw disorders, it fall into how many categories?
Actually, it is classified upon, there are various classifications, but then they are the most prominent which we find in the society are either the prognathic jaws, like if the upper jaw is prognathic, lower jaw is retrognathic. It can be the reverse way, upper jaw is retrognathic, lower jaw is prognathic. It can be the other way, both the jaws are prognathic, both the jaws are coming in front. Okay, so there are various combinations in which the jaw discrepancies can occur. It's not only front and back, but also in the transverse direction. Some jaws don't grow properly in the transverse direction, the left and right direction. They'll be constricted. That again can cause further what we say asymmetries in the face. So there are various categories in which, so on the basis of the clinical examination, we will categorize the patient, and our treatment will be directed in that direction only, in which we have diagnosed the patient. So whatever is required will be done. For this, various diagnostic tools are there. We have the PA views of X-rays, we have the lateral ceph X-rays, the OPGs, various CBCT X-rays are there, so wherein we will come to know exactly how the bone is reacting and where the discrepancy actually lies.
Like if the tooth we are having acts, then this surgery or treatment will make more complicated?
No. See, what happens is there are few situations wherein even after the correction of the teeth, you will not be getting the desired results. Some patients, they come with that gummy smile. For example, a small example I am giving. Some patients come with a gummy smile. Teeth are also crowded. Crowding is relieved, everything looks straight. But still the patient is not satisfied. When she smiles, she has all that gum smiling there. So there is, what is the defect? You have to identify where the defect lies. Okay, we cannot, patients normally they get a little scared when we talk about surgery. But it's like for them only, it's like a permanent solution for them. So even if the teeth are straight and the jaws are not in correct relations, we have to go ahead with the jaw corrections. Then only the patient will be having the desired results. Otherwise, after going such a extensive treatment of 1 to 2 years, and if you don't get your results, then there is no point in doing such a big procedure.
Waste of both money and
time. Because most of what I have seen here is clinicians, just because they lose a patient, they will not say all the details. Because if I say that you have to go for this, and you're like, oh my god, this doctor is telling a lot of things, I have to leave.
Exactly. First they'll panic, obviously.
But that is the truth. You have to tell the patient that you are going to get through all these procedures to have what you are desiring. Otherwise, it is not possible. Because at the end of the day, patient will blame the doctor. Doctor, I am not satisfied with the treatment. Then who is to be blamed? Doctor is to be blamed. You should have taken your stand there and told the patient that this is what's required. Sometimes we can, in borderline cases, we can surely take a chance wherein we can just camouflage the defect. The skeletal defect can be camouflaged, but that is very less percentage of cases wherein we can do that. But most of the patients, we can try to camouflage and give them a good smile. Better they go for a surgical correction. So because today the topic is on the jaw discrepancies and the relationship of the upper and lower jaws. So my advice to all the patients and audiences is that bring your children in time, get them screened periodically every year, so that any discrepancy can be catched and corrected. That is the main issue here.
Now the situation changed, but few people are still in that situation. Like if they get fever, they'll visit a doctor. but even though they are having these disorders, they won't come and meet a dentist. What do you think?
That is what in orthodontics the sad part is there is no pain, there is no discomfort. Unless the patient has something, he won't visit the doctor. So we can conduct camps in that area, awareness camp, orthodontic awareness camps can be conducted, and education can be given to the patients regarding these procedures, and they can be motivated in that. And because in long term, for sure they are going to have some problem. Especially the girls, once they think about all this, just because, as you told, before their marriage or some ceremony, they'll come just 6 months before and tell doctor, make me like Aishwarya Rai. We cannot make you like that overnight. It will take time.
You said that right. I'm very curious to ask. Already you told you'll give preview. So whatever smile we want, can we?
Yeah, there are softwares which can easily design your smile, and they can tell you this is the end result of your smile. This is what you're going to get. Patients having any jaw discrepancies can be on software. We can correct that, and we can show them the profile. You see this, you were like this, and you are expected to be like this after surgery. Maybe 1 or 2%, 5% difference here and there, but major difference will be evident.
Yeah, that's great.
That is a great.
Whatever smile we want, we can recreate.
Yeah, that is the advantage of technology today. Technology has made treatment very easy. The only thing is that we have to adapt the technology. But when we are adapting the technology, we need patients who are also compliant with the payments also. It becomes expensive.
Yes.
That is another issue.
That is I think not another. Most of the people will say that when we go to a dentist, it will be like they'll say all these things and we have to spend a lot. I don't think so that is true. What you will say?
Like, it depends upon the complexity, and I think to spend on yourself for improving yourself, to correct yourself is worth. It's worth doing that. That is for you, not for anybody else. It's for you only.
Yeah, and like we are doing these kind of treatments, there is one very common myth, like if we use this clips or anything, we'll use medicine also, so that it will affect on our hormones and all.
Like somebody is using a medicine?
Yeah, while like we undergo some teeth treatment, then we'll have medicine, alternative medicine. Is there any?
Yeah, there might be some correlation between few medications wherein there can be bone resorption and bone deposition in the body, mostly resorption only. So we have to take a proper history of the patient. If the patient is on some kind of medication, if a child patient is there, whether he has any bone disorders or something like that, that features will be evident once the patient comes in. Like you said, a weak child is coming in, we can first diagnose him as if any problem is there, underlying problem. Because yes, bone defects are there, then you are going to correct the jaws, that is not going to help. You have to balance both the things together. And yes, some medicines do affect the tooth movement, some medicines do affect the bone remodeling. So we have to take everything into account. We just can't, we cannot eliminate the medical part and just go ahead with the dental part. For a healthy patient where we can't find any evident features on clinical examination, okay, we can to some extent ignore, but if you find any kind of feature wherein you can say that this patient is having some medical problem, or the patient tells the doctor, for example, some patients have thyroid, parathyroidism,
exactly,
these things, diabetes is there, juvenile diabetes in children. So all these things have to be taken into consideration before performing any orthodontic correction. You cannot just go ahead, because we need bone, we cannot lose bone.
So how long it will take, minimum time period?
See, if a patient comes for correction in the growth period, so you can take around a year to correct the jaw discrepancies with stability, and then the dental corrections will be another for 6 months. So you can 16 to 18 months you can take the time period. And for the patients who are coming after growth period, where the growth is arrested and they are indicated for surgeries, so for them it will be taking at around 2.5 years by the time the surgery gets over and everything else. So that will be a bigger issue, 2.5 to 3 years for sure, depending upon the discrepancy. Again, the range is there.
Some people will be like, however you motivated, how long you motivate, they will be like some negative minded. So what care you will take about those kind of patients?
So we will know that from the time we start, from the first day when
because we should trust the process, then only it will work.
We have to talk to the patient. The first visit, when the patient comes in, he has to be motivated in the best way, and any kind of reluctancy should be identified. And if the patient is likely to cause any problem in future, I think either you motivate him or you avoid him. Any one thing you can do, because if you're not ready to get motivated, we can't do anything.
Exactly. So you already told, like, by seeing this interview, you hope so many people should get inspired. So what is your motto exactly?
My motto is to prevent these discrepancies entering into children basically. I don't want children to land up into surgeries. My main aim is that. So because I have done cases, I have my own case reports wherein children have changed like anything. The jaws have changed, the appearance has changed, and they're normal now. They don't need any extractions. They don't have to remove their pallu, as you say in Telugu, pallu, and get the teeth corrected. They don't have to go for surgery or something like that. So that growth period has to be taken into serious consideration by the parents. Child will not know.
Yeah, exactly. Parents should know.
Parents should know that basically.
So till now, did you find any more complicated case in this?
Yeah, we have lot of complicated cases.
Lot of.
Especially with the bi-jaw cases are more complicated.
Both.
Sometimes what happens, only one jaw discrepancy will be there, either the lower jaw or the upper jaw. Sometimes both the jaw discrepancy will be there. So wherein we have to deal with both the jaws at a time. We cannot do one at a time. Both the jaws at a time we have to correct. So either if it is this way, it has to come this way. If it is this way, it has to come this way.
So is there any specific reason or it's natural formation?
To start with, it can be genetic predisposition, wherein it's coming from families.
Okay.
Like some people have long jaws that we can identify that through that. Secondly, habits. Children have thumb sucking habits, lip biting habits. Some children have habit of bringing their lower jaw front this way and just maintain it. They'll feel good in that. So that has to be checked.
Because it is in developing stage.
Yeah, it will slowly grow in that way only. My own son, I have to keep on telling him, take it back, take it back, take it back.
Is there any precautions we can take? Like
identify it. You know you should first get your child screened at a correct age. 7 to 8 years of age. If the child gets screened properly by the orthodontist or a general dentist who is having an information, the corrections can be made at the same time. For example, some children, they'll have their upper teeth going back and lower teeth coming out this way. This can be easily corrected in growing stage. It won't require much problem, much instruments, much appliances. Very simply it can be corrected. It will take time. Within a year it will be fine.
Even during milk teeth?
Normally milk teeth we ignore to some extent. But if
I don't think so.
7 years of age, you will not have milk teeth, especially the centrals and the back molars, they'll be erupted. So we are more bothered about the molars, the transverse dimension, and the centrals. That time. So at that time, you can start.
Is there any chance to identify this during milk teeth?
Milk teeth, no. You can keep a check, but as such, because the baby is still growing, milk teeth will be there till around.
You can be sure after.
Yeah, once the permanents erupt. So once the permanents are coming into the jaw, once the permanents are erupting, that is when we have to be very alert. Some people, they say the teeth are erupting from inside. Then there is another tooth in front. So that is the time when you should remove the front tooth. That is the milk tooth. So that the teeth which is erupting should come in front. It needs space. So that space discrepancy will also result in that all malocclusions which are coming in.
Oh, that will also result in this.
There are multiple causes.
Okay.
That is.
So finally, what you want to say to the audience who are looking for this dental protection?
Be well informed. Check your child periodically, and the best you can do for your child is to get him screened at the correct age, that is around 7 to 8 years of age, for both orthodontic or any other dental issues, so that he doesn't land up into serious issues in future. Thank you.
Thank you. So nice meeting you. Thank you. So, చూసారు కదా డెంటల్ స్పెషలిస్ట్లోని జా డిజార్డర్స్ గురించి మరొక ఇంట్రెస్టింగ్ టాపిక్తో మళ్ళీ కలుసుకుందాం. అంటిల్ దెన్ కీప్ స్మైలింగ్. బై బై.